Hello, my name is Kendy Werneck. I'm a biomedic. I'm from Rio de Janeiro, Brazil. I will introduce you to our work. Together with Karina, Doro, and Eduardo Picanço, we'll speak about face restructuring with advanced techniques of PDO thread and hyaluronic acid. To show you the theme, I will start talking about aging. The aging of the face brings several losses of structures, superficial and deep fat pads, muscles, and tissue flaccidity and bone resorption. Thus, age is a cascade of events. The loss of structure overloads other structures, thus generating facial ptosis. One of the preferred treatments for facial ptosis is PDO threads. In order to choose the best technique for implanting the PDO threads, we need to better understand the structures, weight, and strength of our face, mainly from the retaining ligaments. We know that the PDO threads depend on the quantity. Why? The thread that will pull this region will need to be strong or have enough quantity to support all the strength of the ligaments in that region. So, in order to know how to correctly apply the traction technique, it's extremely important to know the weight and strength to retention ligaments in the area that we are going to traction. I went to South Korea for 2 consecutive years. I was able to observe that reserve Korean technique implanted the PDO threads from the anterior to the posterior part, from the soft tissue to rigid tissue, anchoring the thread in the most rigid region on the face. The application is divided into 3 phases. The first phase is the posterior region exactly in the temporal fascium, performing the reposition of the entire temporal fascium. Second phase, the threads are implanted in the zygomatic region. Third stage is jawline region. So these 3 phases can be executed all at the same time separately. I will depend on the needs of ptosis of our patient. And the figure 5 and the schematic drawing, we want to show that the applied technique was used in this patient in 3 phases and refined with the points from MD count CK1, 2, and 3. The amount of the materials used is described in the table. As a result, we can see the photos on the right, left, and frontal face, where the entire region of the face was restructured without losing the individual anatomy of the patient. We followed this patient for about 70 primary days after applying the threads. Even with the weight again, the patient did not lose the result. Therefore, we concluded that the application of the threads in the reversing position, obeying the weights of the retention ligaments, we managed to reposition the tissue with a more comfortable and lasting technique for the patient. Thank you all for your attention.